Hi, my name is Katie Linn, and this is my Health Assessment 1 video. This is my patient, Hannah. She's allowed me to call her Hannah. So before we get started, I'm going to go wash my hands. The importance of doing this is, since I'm going to be touching my patient, to keep cleanliness and make sure that she's comfortable. I'm Katie. I'm a registered nurse today. I'm going to be doing a health assessment on you from your lungs up. Any allergies or pain I need to be concerned about today? No? Okay. I'm going to ask you several questions throughout this. We're in a private setting, keeping things confidential. First, can you tell me your birthday?
February 19th, 1991.
And do you know what we're doing today?
Health assessment.
Okay, and then can you tell me what day of the week it is?
Tuesday.
Yes, sorry. It's been a long day.
It's been a long day.
And she's already stated that she is Hannah. And so she's alert and oriented to ×4, person, place, time, and situation. So her mental status has been assessed and is good. She appears to be calm, dressed for the season, keeping attention span with me. So no barriers for the rest of the assessment that I can see so far. I assessed her vital signs prior to beginning the assessment. Her blood pressure was 126/68. Heart rate we checked along with her pulse ox using the pulse oximetry device. Heart rate was 75. Pulse ox was 99. Her respirations were 18, even and unlabored. No distress noted, and her temperature was 98.6. So everything within normal limits for her vital signs so far. No tachycardia. Like I said, the respirations were good. So I kind of like to start by assessing her skin. That's the first thing you can do without even having to touch anybody. It appears pink. No obvious lesions or anything like that noted. She does have a tattoo on each foot and one on her right ankle. And they're both on her right leg, right ankle, and right top of her foot. So that's the only tattoo she has. Like I said, no lesions, no scars, no upper body tattoos. And so if it's okay, I'm going to go ahead and just touch your face. My hands are cold. And then I'll check each side. And it's dry, warm, so everything seems good there. And I use the back of my hand to check that. While I'm here, kind of on skin, I'm going to go ahead and assess her nails. She does have on the artificial nails, but if she didn't, it'd be really good to check cap refill. Well, I kind of can. And then bilaterally do this. Oh, sorry. And then you can also do it on her toes, checking for any cyanosis. And I was able to get it in cap refill. Let me get it really good. Yeah, it's definitely less than 3 seconds. No clubbing of her nails. They seem trimmed appropriately, especially under her artificial nails. And I assess that bilaterally. Now, just the general head assessment. I can tell that her head is normocephalic, very symmetrical, proportionate to her body. Everything else looks symmetrical. And then I'm going to go ahead and touch your head. I'm palpating just her head to make sure I don't feel any lesions, any cysts or anything like that on her scalp. Her scalp has good texture. It's good and pink. I don't see any spots or balding areas. Her hair is brown. It's thick. It's not brittle. Like I said, no patches that I can see. Evenly distributed. And no redness or bruising. So I'm going to go ahead and assess cranial nerve 5 and 7, trigeminal, and facial. And so if you can just, well, first I can tell that there's no drooping on her face. And so if you can smile real big for me. It's symmetrical. And then just, I'm going to touch your face in different spots to just make sure it feels the same. No numbness or anything else specifically on either side. Feels the same? Okay. So cranial nerve 5 and 7, trigeminal and facial are intact. And then I'm going to go to her eyes. I can see that her eyes are green hazel. Pupils look good, normal. Her sclera is white. Nothing else I really see. Her eyebrows are normally distributed. Eyelashes are good, no patches or blank areas. Let's see. First, I kind of want to do the Snellen chart. I printed one off of the internet. And so she's going to use this little compact book to cover one eye. And so I'm going to tell you to cover one eye, and then I'll just have you read the 8th line for me if you can. So we'll start with this eye if you'll hold it. Thank you. And then we've got it set up.
8th line.
Okay.
D, E, F, P, O, T, E, C.
Okay. And now change to the next eye, and I'll read the same line.
D, E, F, P, O, T, E, C.
Okay, good. Okay, so we did the Snellen chart 20 feet away. Let's see. Now I'm going to go ahead and do the cardinal fields of gaze. And so what I'm going to do is put my finger in front of you about 12, 14 inches away, and then you just keep your head still and have your eyes follow my finger, okay? Good. Does it hurt or anything?
No.
Good. Okay, and now I'm going to go ahead and use my pen light, and I'm going to just put this real far away and then bring it closer to your nose. Don't move your head again, and just let your eyes naturally cross, okay? So just let it, oh man. Okay, it followed it, good. And then now I'm going to dim the light and assess her pupils. Okay. So what I'm going to do is use my pen light, and from each side I'm going to come in and just keep your head straight. Focus on just some little point on the wall, and I'm going to see if her pupils constrict. Okay? Make sure you can see me. Good. Okay. There we go. So her pupils were equal, round, reactive to light, and accommodation. If I had an ophthalmoscope, I would check for, I would put it in my dominant hand and check for the red reflex and look at her retina. With the retina, we're trying to view her optic nerve, and so if I had one, that's what I would do on each side. So, given what we assessed, I assessed cranial nerve 3, 4, and 6, oculomotor, trochlear, and abducens. That's it. Okay. Now I'm going to move on to her nose. Like I said before, it appears midline. No deviations, lesions. Let me touch your nose. But no pain, no tenderness. Okay, then I'm going to look up in your nose if you'll just. Good. Her hair is evenly distributed. I don't see any deviated septum. If you will, cover one nostril and sniff real good. And now on the other side. No pain or any obstruction. So no obstructions noted. She did it good. No tenderness. It looked pink. Like I said, hair is evenly distributed in the mucosa, and her nares are patent. So if I had an otoscope, we would use that to look further up and check further for the deviated septum and such. So another thing we can do to assess cranial nerve 1 olfactory is have her close her eyes, and I would put a scent under her nose, like vanilla or cinnamon, and she could tell me the scent to assess that. So we would do that if we had the supplies. Okay, mouth. I like this. I can see that her lips aren't cracked. They're pink. They're symmetrical. Everything looks good there. And so I don't have a tongue blade, so I'm just going to use some cotton swabs and use my pen light to assess. So what I'm going to do is, if you'll open your mouth real wide, I'm just going to, okay, go. Okay, I can see her uvula and her tonsils back in there. Let me just keep it. Her oral mucosa is pink and moist. She has all her teeth, and we discussed earlier she has her wisdom teeth. I can assess her hard and soft palate. Her tongue has a rugate. Now lift your tongue up for me. Good job. Okay. Good integrity of her hard and soft palate. The hard palate has that rough area surface, and then the soft is good and soft and pink. Her gums looked good, no lesions or anything like that. Like I said, her teeth were symmetrical. Bite down real hard on your teeth. Okay, that looks good too. And then try to open your mouth and push against me. Okay, good. Good, good. Like I said, her tonsils were present. Everything looked normal when she bit it down. Stick your tongue out for me. Just stick it out at me. Good, real good. So we assessed cranial nerve 9, 10, and 12. Glossopharyngeal, vagus, because she's able to talk, swallow, everything normal. And then hypoglossal, sticking out her tongue. Okay, and then ears. They're symmetrical, look normal in color, and I'm just going to kind of pull on your ears. No tenderness, nothing like that. She has some earrings in. It feels fine. Okay. And then, so everything looks good. Her ears are normal color, symmetrical to her head. So if you'll stay turned, I'm just going to inspect her outer ear. Okay. Looks like typical cerumen is present. No lesions, anything like that. I'm just using my pen light. If I had an otoscope, I could look deep into her inner ear, tympanic membrane. I would pull the pinna up and back and like this, kind of real hard. And then I would note the malleus and the tympanic membrane, and all that's a shiny gray. And I would use my dominant hand as well for all the instruments we would use. Now I'm going to test the cranial nerve 8 acoustic. And so, Hannah, what I'm going to do is just occlude or cover one of your ears and whisper something, and you tell me what I say, okay? Baseball. Okay, now let's switch to the other side.
Apple, banana.
Okay. So she heard everything I said, and I made sure that she couldn't read my mouth. You know, she had to listen. And so that was testing cranial nerve 8 acoustic. Now, her neck. It looks symmetrical and good. Let's do some range of motion, Hannah. If you can just lower it front and back. Real good. No pain or anything. Now, side to side. Okay. Now, if you'll do the side to side with me feeling. I don't feel or hear any crepitus. Now, shrug your shoulders up at me. Real good. And now do it real hard. Yeah, so she can shrug her shoulders good even with resisting me. So good trapezius and everything was strong. Let's see. That was testing cranial nerve 11 accessory with the head, neck, and shoulder shrugging. Now I'm going to use my stethoscope. Well, first I want to just feel your carotids. It's important to assess the carotid arteries not at the same time, because you can make them pass out and cut off blood flow. So just sit still, and I'm going to feel. Okay, she's got strong carotid, probably like a 2+. Okay, so I was able to palpate the carotid arteries. They were both strong, seemed regular. So now along that, I'm going to listen for any bruits with the bell of my stethoscope. So if you can just turn your head the opposite direction against me. Okay, now take a deep breath, let it out, and hold your breath. Okay? Now hold it. Okay, now turn your head this way. Deep breath in and out. And on the out, hold it. Okay, no bruits were heard. And I used the bell of my stethoscope. Okay, now I'm going to palpate for any nodes. or palpate her nodes to see if there's any issues going on with that. And so what I'm going to do is you'll kind of face me a little bit more, that way they can see good, and I'm going to take the notes. I'm going to touch all over your face and head, okay? Okay, first we're going to do pre-auricular, posterior auricular, occipital, this is tonsillar, submandibular, submental, and then superficial cervical, bringing my fingers down the deep cervical chain, and then posterior cervical, and then supraclavicular. Any tenderness in any of that I just did. Okay, so we're good there. And so no nodes were palpable. Then we're going to move on to the thorax and lungs. Her skin looks good on her chest. No issues going on there. No pain going on prior to the assessment. No lumps noted. And then I'll also assess her back, so we'll have her turn around in a minute and do that. And so we already assessed no difficulty. And so I'm just going to feel all over. No difficulty there. Now, if you will, take an inhale and exhale real big. Okay, I can palpate her inhaling and exhaling. Nothing seems wrong there. Okay, and then I'm just going to listen to the front of her and assess tactile fremitus. So, as I listen, I'll tell you when, and if you'll say 99 each time I move my stethoscope, okay? Okay, there you go. Okay. You can say 99. 99. Say it again.
99.
I know, that's awkward. Okay. Now, one.
99. 99.
Okay. So no tactile fremitus heard. And so while I'm here, I'm going to go ahead and really listen to her lungs really good. So it's going to be important for you to take some really good, deep breaths, okay? I'm going to listen in at least 6 spots all over. I'm going to start way up high at the apex. All right. Good job. Keep going and going. Okay, her lungs sounded good and clear throughout. I've heard all her lung fields on anterior chest really good. No adventitious breath sounds heard. Now, if you don't mind, I'm going to go ahead and have you just stand up. That way you can see your back. And we're going to do basically the same thing. So if you'll turn around, I'm going to just place my hands on your back, and you just inhale and exhale, okay? Okay, good chest diameter. Okay, and now let's do the tactile fremitus. If you'll say 99 each time I place my stethoscope. Okay, ready?
99. 99. 99. 99.
Okay, no tactile fremitus heard. Now I'm going to listen to your lungs. So breathe good and deep, okay? Almost done. Sorry. We're going to listen in a lot of places on her back. Okay, that's good. And then I'm just going to percuss just a little bit for some resonance. I don't hear any. Okay, so turn back around one more time. And then we're almost done. Okay, nothing strange heard upon that. Okay, and so that concludes the patient part of my video. I appreciate it, Hannah.
Thank you.
And so you can step away, and then we'll talk about a breast assessment. Okay, for the breasts, since we won't be doing it in real life, the important thing is to have the patient do like 3 position changes to view the breast, to make sure there's no dimpling, anything strange like that, eversion or inversion, and you can see some like edema or any visible masses. And so it's important to do that like 3 times is really good. And then while the patient's sitting up, you can squeeze the nipple for discharge or check for any tenderness there that's abnormal. And then to do a good breast assessment, you'll have the patient lie down with their arms way above their head, and then you can assess the breast in a circular fashion all around, and then going on into the axillary nodes. And so, let's see, I think that's it. That's it. Thank you very much.